Okay, today we're going to talk about something that a lot of people experience, but very few people talk about the feeling of vaginal laxity. It can be really confusing, but here's the good news. Once you understand the cause, finding the right solution becomes so much clearer. And that's exactly what we're going to break down right now.
First things first, if you've ever felt this way, please know this. You are absolutely not alone, and no, you are not imagining it. It's a real sensation, it is incredibly common, and we can tackle it with some really clear, evidence-based information. So what do we even mean by vaginal laxity? Well, and this is a really important point, it's not some formal medical diagnosis your doctor writes down. It's a personal feeling, it's your experience of maybe feeling a bit looser or like there's less support down there. And that personal feeling is what really matters here. So let's dive into the details of this really common, but yeah, often unspoken feeling. Because once we get a handle on the why behind it, figuring out what to do next gets a whole lot easier. This brings us to the big question, right? You might be thinking, okay, if lots of women feel this at different points in their lives, why do we have to get so specific about the cause? Isn't there just one fix for everyone? And the answer to that is a big, resounding no. One size definitely does not fit all. You see, the reason for that feeling is totally different depending on whether you're recovering from childbirth or you're going through menopause. It's like a fork in the road, and choosing the right path is everything when it comes to getting care that actually works. So this brings us to the two very different stories we're going to explore. Let's start with the first one, the changes that can happen to your body right after having a baby. Now this slide, this really gets to the heart of it. It lays out the two paths so clearly. You see, the post-birth story is all about the mechanics, the muscles, the structures that hold everything up. But the menopause story, that's totally different. It's all about the health and the actual comfort of the tissue itself. We're talking two different problems that need two very different toolkits. Okay, let's walk down that first path, the post-birth story. What we're really talking about here is the incredible physical journey your body has been on through pregnancy and delivery, and the impact that has on your internal support system. So after childbirth, it makes sense, right? Your pelvic floor, which is kind of like a supportive hammock of muscles, has been stretched. The tissues that connect everything might be a bit looser, and if you have a scar from tearing or an episiotomy, even its position can change how supported you feel. At its core, it's a mechanical issue. And because it's a mechanical muscle-based issue, the best solution is also mechanical. We're talking about pelvic floor muscle training, or PFMT. And listen, this isn't just some casual suggestion. This is the official, first-line, evidence-based treatment recommended by the UK's NICE guidelines. It's the proven starting point for getting those muscles working properly again. All right, now let's switch gears and walk down that second path. For women in perimenopause or menopause, the story is completely different. The problem usually isn't about stretched muscles at all. It's about hormonal changes that affect the actual fabric of the vaginal tissues. The culprit here is usually something called Genitourinary Syndrome of Menopause, or GSM. Basically, as estrogen levels drop, the vaginal walls can get thinner, drier, and lose some of their natural stretchiness and lubrication. This is what creates that strange paradox so many women describe, feeling loose yet sore at the same time. So here's the key takeaway. You could have pelvic floor muscles as strong as a trampoline, but if the tissue itself is dry and less resilient because of GSM, you might still get that feeling of laxity. It's not about muscle weakness, it's about friction and a loss of that natural tissue cushion. Okay, so we've established two very different problems, right? One is about muscle and structure, and the other is about tissue and comfort. It only makes sense that they would need two completely different primary solutions. So, how do we find the right tool for the right job? To actually solve the problem, you've got to match the solution to the cause. So let's take a look at what the evidence-based guidelines say we should be reaching for. And this table just lays it all out perfectly, side by side. After birth, the cause is muscle stretch, the feeling is often reduced grip, and the solution is supervised PFMT. After menopause, the cause is GSM from a drop in estrogen. The feeling is that loose yet sore sensation. And the first-line treatment is GSM care, like local vaginal estrogen. Honestly, this slide is the core message of this whole explainer. So for anyone on that postnatal path, PFMT is your toolkit. And it's pretty straightforward. It's about building endurance with those longer, slow holds. It's about building power with quick little squeezes. And then there's the knack. That genius little trick of doing a quick squeeze just before you cough or sneeze to give you that extra support right when you need it. Now, for those on the menopausal path, GSM Care is your toolkit. Local estrogen isn't a tightening cream. What it actually does is restore the health, the thickness, and the stretchiness of the tissue itself. It solves the real problem, the dryness and friction, which, in turn, usually makes that sensation of laxity go away.
Okay, so now you get the two paths. You understand the different causes. So, what are the practical, safe next steps you can actually take? And maybe just as important, what should you be a little bit cautious about? Now, this is so important. You've probably seen ads for things like vaginal rejuvenation, using lasers or radiofrequency. Well, let's be really clear about the official stance. In the UK, NICE says it's still investigational, not for routine use. In the US, the FDA has literally issued safety warnings about burns and scarring. And in Australia, they're canceling approvals because there just isn't enough evidence that it works. These are not your first-line treatments. So if you're postnatal, here's your clear, evidence-based game plan. Start doing those pelvic floor exercises at home. Ask your doctor for a referral to a pelvic health physio. Getting expert guidance makes a huge difference. And just be kind to yourself. When you're ready to be intimate again, take it slow and use plenty of lubricant. And if you're on the menopausal path, here's your roadmap. The most important first step, book an appointment to specifically talk about GSM. From there, it's about building that daily toolkit. Regular vaginal moisturizers for hydration, specific lubricants for intimacy, and having a conversation with your provider about whether local vaginal estrogen is right for you. So we've covered the two paths, the two causes, and the two targeted solutions. The whole journey really just starts with figuring out which path you're on. So the final question is for you. Based on everything we've talked about, what's the first small step you can take today to get the right care for your body?